Hello everyone, thank you for watching my video. Allow me to introduce myself. I'm Kidan. I'm from Ethiopia. I'm based in South Africa at the University of the Western Cape School of Public Health, where I work as a program manager, and I'm also a doctoral student. My presentation briefly highlights the experience of my university in implementing a multi-country capacity development intervention in the area of human resource for health, and I would like to demonstrate how complex implementation of this intervention has been, and how we try to navigate the challenges we faced, and also how we try to incorporate a learning component to the whole implementation process. And I hope you'll find my presentation informative. As you will know, Sub-Saharan Africa is facing a crisis of human resource for health, which is affecting 36 countries in the region. The region, despite carrying 25% of the global disease burden, only has 3% of the health workforce. And according to WHO, the region requires additional 1.5 million health workers to be able to meet the basic needs of its people. And this crisis has been attributed to several factors, among which lack of leadership at national level, and also the low production of health workers in the countries have been cited as the main ones. Against this background, WHO initiated an intervention called a Model a Master's Program on Health Workforce Development, which is to be implemented by a consortium chosen by WHO, and this consortium is led by the University of the Western Cape in South Africa, and it's joined by universities from Mozambique, Rwanda, and Ethiopia. This intervention has three main goals. The first one being strengthening the academic capacity of partner institutions, and also building leadership capacity of Ministry of Health in the countries, and finally to develop an African platform for advancing the field through a set of activities including training, embedding programming in institutions, and developing curriculum, material, and staff. And the different institutions play different roles, whereby WHO is providing the financial support and disseminating the concept, while UWC plays a very critical role as the whole intervention tries to draw from its experience as a WHO collaborating center for training and research in this particular area, and it's also responsible for carrying out different activity roles such as conferring degree, supporting partners to embed the program locally, and also advancing the field in the region. And the other universities are responsible to draw from UWC's experience, and also select students to be trained for this master's program, and they also have to champion and embed the HRH teaching in their own institution. And there have been great progresses made in implementation, looking at the training of the 18 enrolled in the master's program for health, and were considered as a critical mass of leaders in their own respective countries and are expected to advance the field. There, 6 have already graduated, and the rest are expected to graduate next year. And looking at the program integration locally, the different partners are at different stage of implementation, and they have also chosen to follow different routes depending on their local realities. For instance, one of the partners is planning to adapt a similar master's program to implement next year, and they have reviewed curriculum and also adapted their materials to this end. And another partner decides to start with a certificate program and consider its options in the future. And the third partner, since it has joined the partnership at a later stage, is still contemplating what directions it's going to follow. And there have been several challenges in implementation process at an individual, institutional, and context level. The individual challenges were the fact that some of the students have language barrier and weak academic skill, which can be attributed to the way they have the selection process has been conducted in the countries. And there were also institutional challenges such as lack of capacity to champion the initiative, competing and changing institutional priorities, and also inability of the institutions to provide adequate support to students who are based outside the city. And contextual challenges include complexity of navigating local realities. It was difficult to really understand the relationship and influence stakeholders such as the Ministry of Health has on the universities. And there were also difficulties of finding senior academicians who can play a role of mentors for this program, because even the ones we had were overworked and difficult to access. We try to navigate these challenges through a set of strategies, including consultation, flexibility, adaptation, and learning. And the learning component has two main objectives: to understand how and why implementation is enabled or constrained by different factors and conditions, and also to understand capacity and capacity development as a systems development in the context of this intervention. We have chosen systems perspective as a framework to guide the whole interrogation learning process. And we chose this framework because it considers capacity development as not being influenced by external intervention alone, but also by external context, stakeholders, internal resources and processes as well. And it also makes a distinction between capacity, performance, and change. And we have drawn a set of questions to from this framework to guide the interrogation process. And the questions focus on key stakeholders and their interests, their assumptions, if that has changed over time, and the organizational processes and systems, and relevant organizational learning needs as well. And we adapted a qualitative research methodology to for this purpose, particularly case study and reflective practice. The key messages of my presentation and the whole implementation process is the need to engage with complexity through learning, adaptation, and flexibility, and also to consider capacity development as systems development, the capacity sitting at different layers which are interacting with one another, and also to consider capacity and the change that we're trying to bring about as an emergent features which are not influenced only by external intervention, but a whole set of interactions and conditions happening in the local context where they are situated in. I've come to the end of my presentation. Thank you again for watching my video. If you have any questions, please don't hesitate to contact me. There is my email. And if you're also interested in learning more about projects implemented by my university, please log on to our website and contact us. Thank you very much.